Zaki's family went through a health scare back in March. His son began showing symptoms of COVID 19, including a high temperature and shortness of breath.
Sempat dirawat seminggu di
When he
rumah
started to
sakit
complain about
Jakarta
shortness of breath, I
pada
didn't think much of it. We
harapan
went to the
kemarin Sabtu.
hospital
Terus
and he was classified as patient under observation for
seminggu
COVID
lah
19.
dirawat lalu
I was
keluar.
worried because back then we
Menurut
just couldn't
dokter
know for sure. We didn't
nggak
have
apa-apa,
easy access to
hanya
rapid
sesak napas
tests
dan
back in
bisa
March.
berjalan.
Although his son recovered weeks after that scare, as a parent, Zaki says the experience was traumatic, and many children across Indonesia are not as lucky. According to data released by the Indonesia Pediatric Society, at least 2,000 children in the country have tested positive for COVID 19 since March. Those numbers do not include children who have COVID 19 symptoms but have supposedly not tested positive for the virus. Thousands of them are currently under strict supervision by the health ministry. We personally reached out to the Indonesia Pediatric Society, but they declined to comment any further, saying that the government is still working to resolve this ongoing issue. Health officials say the high number of child deaths in Indonesia are due to underlying factors.
There are several burdens already within the children in Indonesia, such as infectious diseases, malnutrition, and for the infectious diseases, there are several cases related to dengue hemorrhagic fever, malaria, pneumonia, diarrhea. Those are the infectious diseases that give the burdens to the children. And of course, when they are infected with COVID, and the ability for the children to survive sometimes hindered because of that.
This includes the quality of healthcare across the region. Many hospitals in remote areas do not have the capacity to treat thousands of sick patients per day due to lack of doctors and equipment shortages.
The government of Indonesia now are putting more attention to the programs other than COVID-19 to make sure that the burden to the children will be lessened. And that's why the immunizations program for other diseases are improved, and the healthcare centers program with the cadre, etc., are also strengthened to make sure that we can survive not only to COVID but also to other infectious diseases that challenge the children.
The COVID 19 pandemic has highlighted Indonesia's long battle with infectious diseases and the government's need to strengthen that fight. Silkina Ahluwalia, CGTN, Jakarta.